Nearly half of CUPE hospital workers in Ontario are considering quitting their jobs. That's according to a new survey that paints a grim picture of the healthcare system and illustrates the gravity of the staffing crisis that the union says is reaching its breaking point.
The future is bleak. Hospital workers are losing hope.
Crushing workloads and poor compensation. The union, representing thousands of Ontario healthcare workers, says those are the two main reasons so many are leaving the sector. And they're calling the results of their latest survey alarming. Of 775 healthcare workers polled, including nurses, PSWs, and occupational therapists, 41% said they dread going to work, while 43% said they're considering leaving the sector.
This sense of hopelessness and despair is driving workers away.
Another 79% of those polled say they are not confident in the Ford government's plan to improve the sector in 2024, while 69% say they're not staffed well enough to deliver high-quality patient care, and 52% are unhappy with their wages.
Higher compensation is direly needed at this stage when shortages are crippling our ERs and other services.
Nurses tell us many of them are burnt out and feeling undervalued.
The wages are not keeping up with the inflation. Nurses are the backbone of the healthcare industry.
CUPE says there are currently 19,000 vacancies at hospitals across Ontario and estimates 60,000 staff are needed over the next 4 years to keep up with population growth and aging. They're proposing the government set a minimum standard of staff-to-patient ratios and calling for a $1.25 billion investment annually over the next 4 years to improve staffing levels.
We think it's a very reasonable ask when we find ourselves in an unprecedented crisis.
They add the staffing crisis is directly tied to a decline in quality patient care. Ontario's Auditor General says there were more than 200 temporary ER closures between July 2022 and June 2023. 100,000 Ontarians are also currently waiting beyond medically recommended guidelines for surgeries.
Many workers are breaking down and crying, knowing their patients are being shortchanged, knowing that they are operating in a system designed to fail.
The province's watchdog adding the government had no real plan to deal with the nursing shortage in Ontario. We did get a response from a spokesperson for the Minister of Health who says last year alone they added 15,000 nurses to the healthcare system. They also say they're breaking down barriers to make it easier for nurses to join the profession both internationally and domestically. For City News, I'm Tina Yazdani.